Reflux, gas and colic in babies, what's normal and how to help. Hi everyone, and welcome back to our channel. If you're a parent with a baby who cries a lot, spits up, or seems uncomfortable after feeding, you're not alone. In the early months of life, babies experience a variety of digestive issues, including reflux, gas, and colic. These are generally normal and part of a developing digestive system, but they can be distressing for both the baby and the caregiver. Today we are going to talk about reflux, gas, and colic in babies. What they are. The signs to look for. And, most importantly, what you can do to help your baby and yourself through this phase. Grab a cup of tea, take a deep breath, and let's get started. Part 1. What is reflux, gas, and colic? Let's start with definitions. Reflux, also called gastroesophageal reflux, GER, happens when milk flows back from the baby's stomach into their esophagus. This is very common in babies under 12 months. Why? Because their digestive system is still immature and the valve that closes the top of the stomach isn't fully developed yet. Babies with reflux might spit up frequently, especially after feeding, arch their back or seem uncomfortable, cry during or after feeds, sleep poorly when laid flat. Next, gas in babies refers to trapped air in the digestive tract, either swallowed during feeding or formed during digestion. A gassy baby may be fussy, especially after feeds, fold their legs up to their tummy, fart or burp frequently. Now, colic is a bit different. Colic is not a diagnosis, but a term used when a healthy baby cries excessively, often in the evening, for no obvious reason. The rule of 3 is often used. Crying for more than 3 hours a day, more than 3 days a week, for over 3 weeks. Colic usually peaks around 6 weeks of age and settles by 3 to 4 months. Part 2. Why do these happen? Reflux, gas, and colic are normal parts of baby development, but they can be hard on both the baby and the caregiver. Here's what's going on. Reflux is mostly mechanical. The valve at the top of the stomach, called the lower esophageal sphincter, is immature and weak. Gas can come from swallowing air, especially if the baby is crying, feeding fast, or has a poor latch. It can also be produced in the gut when digesting certain proteins or sugars. Colic has no one known cause, but theories include overstimulation, digestive discomfort, sensitivity to milk proteins, or even the baby's temperament adjusting to life outside the womb. Part 3. How to tell if it's reflux, gas, or colic. Let's break down key signs to watch for. Reflux, gas, and colic. How to spot the difference. No table. Let's break down 6 common signs to help you figure out if your baby might have reflux, gas, or colic. Sign 1. Spits up milk after feeds. This is a classic sign of reflux. Babies with gas or colic usually don't spit up much. Sign 2. Cries mostly in the evening. If your baby cries for hours, mainly in the late afternoon or evening, but is otherwise healthy, it's likely colic. Reflux and gas tend to cause fussiness at any time of day. Sign 3. Pulls knees up to chest. This often means gas or colic. It's your baby's way of trying to relieve tummy discomfort. Babies with reflux don't usually pull their legs up like this. Sign 4. Seems worse when lying flat. That's a sign of reflux. The milk or acid can move upward and make them uncomfortable when they're on their back. Gas and colic don't usually get worse with position. Sign 5. Lots of burping or farting. That usually points to gas, and sometimes colic. It means air is trapped in the tummy or moving through the bowels. Babies with reflux might not be as gassy. Sign 6. Comforted by cuddles or feeding. If feeding and cuddles calm your baby, it's more likely reflux or gas. But if your baby keeps crying even when held or fed, that's a common sign of colic. Wrap up. Remember, your baby might have a mix of all 3. Reflux, gas, and colic often overlap. The good news is, all of them tend to improve with time. You're doing an amazing job, and just by noticing these signs, you're already helping your baby feel better. If your baby has persistent vomiting, poor weight gain, or blood in the stool or vomit, it's important to see a doctor. Part 4. What can you do to help? Now for the good news. You can help your baby feel more comfortable. For reflux, feed upright and keep baby upright for 20-30 minutes after feeds. Offer smaller, more frequent feeds. Burp often during and after feeding. Raise the head of the crib slightly, check safety guidelines. Breastfeeding? Work with a lactation consultant if you have a fast letdown or oversupply. For gas, burp between and after feeds. Try bicycle legs or gentle tummy massage clockwise. Make sure your baby is latched well and not swallowing air. Some babies respond well to probiotics. Ask your health professional. For colic, try white noise, swaddling, rocking, or a warm bath. Take turns with a partner or support person. Keep a crying diary to track patterns. Remind yourself, you are not doing anything wrong. If you're overwhelmed, it's okay to put baby down in a safe place and take a few minutes to breathe. Talk to your child health nurse or doctor. They can rule out medical causes like cow's milk protein allergy or reflux disease. Part 5. Final thoughts and support. Being a new parent is hard, especially when your baby is uncomfortable and you don't know why. Remind yourself, this is temporary. Most babies grow out of reflux, gas, and colic. Your baby's cries are not your fault. Take shifts with your partner. You are doing a great job, even when it feels like you're not. You don't have to go through this alone. Talk to your healthcare provider or other parent support. And please, look after yourself, too. Dealing with reflux, gas, or colic can be tough, but remember it's usually temporary. Try these tips, stay patient, and always reach out to your pediatrician if you're concerned. Drop a comment below if you've found other tricks that work. We'd love to hear from you. If this video helped, please give it a like and share it with another parent who might need it. And don't forget to subscribe for more parenting tips and support.